Nurse Aide Practice Exam 1. Question 1. What is the most important action a nurse aide can take to prevent the spread of infection? Option A. Wearing gloves at all times. Option B. Performing hand hygiene. Option C. Wearing a mask. Option D. Isolating all clients. The correct answer is option B. Performing hand hygiene. Hand hygiene is the single most effective measure to prevent healthcare-associated infections. Gloves, masks, and isolation are important but do not replace hand washing. Hand hygiene breaks the chain of infection at the most common transmission point. Question 2. When providing care to a client with dementia, the nurse aide should: Option A. Maintain a consistent routine. Option B. Change the routine daily. Option C. Avoid eye contact. Option D. Speak quickly. The correct answer is option A. Maintain a consistent routine. A consistent routine provides structure and reduces confusion and anxiety. Changing the routine daily increases agitation. Avoidance of eye contact and speaking quickly are not therapeutic. Question 3. What should a nurse aide do if they experience a needle stick injury? Option A. Wash the area and report it immediately. Option B. Wait to see if symptoms develop. Option C. Apply pressure to the wound. Option D. Ignore it if no blood is visible. The correct answer is option A. Wash the area and report it immediately. Immediate washing reduces bloodborne pathogen transmission risk. Prompt reporting allows post-exposure prophylaxis if indicated. Ignoring any exposure is never acceptable and violates OSHA standards. Question 4. A client who is anxious and pacing should be: Option A. Placed in a chair and restrained. Option B. Encouraged to talk about what is bothering them. Option C. Given a sedative. Option D. Ignored until they calm down. The correct answer is option B. Encouraged to talk about what is bothering them. Encouraging the client to talk about their concerns helps identify the cause of anxiety and may provide relief. Restraint is inappropriate for anxiety. Sedatives require a physician's order. Ignoring them leaves them to suffer alone. Question 5. The nurse aide's primary scope of practice includes: Option A. Performing sterile procedures. Option B. Inserting urinary catheters. Option C. Assisting with activities of daily living. Option D. Administering medications. The correct answer is option C. Assisting with activities of daily living. The nurse aide's primary role is assisting with ADLS such as bathing, dressing, toileting, feeding, and mobility. Sterile procedures, catheter insertion, and medication administration require licensed nursing staff. Question 6. When removing PPE, which item should be removed first? Option A. Gloves. Option B. Gown. Option C. Mask. Option D. Goggles. The correct answer is option A. Gloves. Gloves are the most contaminated item and should be removed first to avoid contaminating other items. The correct sequence is gloves, goggles/face shield, gown, mask. Question 7. What is considered a normal blood pressure for an adult? Option A. 90/60 mmHg. Option B. 110/70 mmHg. Option C. 130/90 mmHg. Option D. 140/100 mmHg. The correct answer is option B. 110/70 mmHg. Normal blood pressure is less than 120/80 mmHg. 110/70 falls within the normal range. 90/60 is low, hypotension. 130/90 and 140/100 are elevated and indicate hypertension requiring medical attention. Question 8. When caring for a dying client, the nurse aide should: Option A. Keep the client's room dark and quiet. Option B. Allow the client to express his feelings. Option C. Change the subject if the client talks about death. Option D. Contact the client's minister, priest, or rabbi. The correct answer is option B. Allow the client to express his feelings. Allowing a dying client to express feelings about death and dying is essential for emotional support. Changing the subject or avoiding the topic is inappropriate. Keeping the room dark is not necessary and may increase isolation. While offering spiritual support is appropriate, the aide should not assume the client wants clergy contacted without asking first. Question 9. Range of motion, ROM, exercises are performed to: Option A, build muscle strength. Option B, prevent contractures and maintain joint mobility. Option C, increase weight. Option D, decrease appetite. The correct answer is option B, prevent contractures and maintain joint mobility. ROM exercises prevent contractures, permanent shortening of muscles, and maintain joint mobility. They are important for clients with limited mobility. Question 10. When a client is being discharged, the nurse aide should: Option A, assist with packing and ensure the client has their belongings. Option B, tell the client to call if they need help. Option C, let the client pack alone. Option D, rush the client to leave. The correct answer is option A, assist with packing and ensure the client has their belongings. The nurse aide helps ensure the client has all their belongings and assists with packing as needed, promoting a smooth, dignified discharge. Rushing is disrespectful. Question 11. What should the nurse aide do if a client's oxygen saturation drops to 90%? Option A, increase the oxygen flow. Option B, report it to the nurse immediately. Option C, reposition the pulse oximeter probe. Option D, document the reading. The correct answer is option B, report it to the nurse immediately. An SpO2 of 90% is below normal, 95 to 100%, and requires immediate reporting. CNAs cannot adjust oxygen. While repositioning the probe might be attempted, reporting to the nurse is the priority. Question 12. What is the correct position for a client receiving oral care to prevent aspiration? Option A, supine position. Option B, Fowler's position. Option C, prone position. Option D, Sims position. The correct answer is option B, Fowler's position. Fowler's position, semi-sitting, prevents aspiration by allowing gravity to aid swallowing. Supine, flat, increases aspiration risk. Prone is not appropriate for oral care. Sims is used for enemas and rectal procedures. Question 13. Which of the following items is used in the prevention and treatment of bed sores or pressure sores? Option A, rubber sheet. Option B, air mattress. Option C, emesis basin. Option D, restraint. The correct answer is option B, air mattress. An air mattress, or pressure-reducing mattress, helps prevent and treat pressure ulcers by redistributing pressure on bony prominences. Rubber sheets can trap moisture and increase skin breakdown. Emesis basins are for collecting vomit. Restraints are not used for pressure sore prevention. Question 14. A client is pacing and appears anxious. The nurse aide should: Option A, ask the client to sit down. Option B, walk with the client. Option C, give the client a sedative. Option D, leave the client alone. The correct answer is option B, walk with the client. Walking with the client provides exercise, reduces anxiety, and allows the aide to monitor for safety. Asking them to sit down may increase anxiety. Sedatives require an order. Leaving them alone may be unsafe. Question 15. A client who is agitated and wandering should be: Option A, restrained to ensure safety. Option B, redirected calmly to a safe area. Option C, left alone to tire out. Option D, given medication to calm down. The correct answer is option B, redirected calmly to a safe area. Redirection is the safest and most respectful approach. Calmly guide the client to a safe area and engage them in an activity. Restraints require an order and are a last resort. CNAs cannot administer medication. Question 16. Which method of temperature measurement is considered most accurate? Option A, oral. Option B, axillary. Option C, tympanic. Option D, rectal. The correct answer is option D, rectal. Rectal temperatures most closely reflect core body temperature and are considered the gold standard. Oral temperatures are affected by eating and drinking. Axillary temperatures are least accurate. Tympanic readings can be affected by earwax and positioning. Question 17. A client with a history of falls has been repositioned. The nurse aide should also ensure: Option A. The bed is in the highest position. Option B. The room is completely dark. Option C. The bed is in the lowest position and the brakes are locked. Option D. The client's family is called. The correct answer is option C. The bed is in the lowest position and the brakes are locked. The bed should be in the lowest position to reduce fall injury risk, and the brakes must be locked. The room should have adequate lighting. Calling the family is not part of the safety routine. Question 18. When feeding a client who has difficulty swallowing, the nurse aide should: Option A. Feed them quickly to minimize aspiration risk. Option B. Place food on the affected side of the mouth. Option C. Place food on the stronger side of the mouth. Option D. Use only liquids. The correct answer is option C. Place food on the stronger side of the mouth. Place food on the stronger or unaffected side to help the client control and swallow. Feeding quickly increases aspiration risk. Placing food on the affected side can cause choking. Only liquids ignores the ordered diet consistency. Question 19. When should a nursing assistant perform hand hygiene? Option A. Before touching a client. Option B. After removing gloves. Option C. After touching client surroundings. Option D. All of the above. The correct answer is option D. All of the above. The CDC's 5 moments for hand hygiene include: before touching a client, before clean/aseptic procedures, after body fluid exposure, after touching a client, and after touching client surroundings. Removing gloves does not substitute for hand hygiene. Question 20. The nurse aide notes a reddened area on a client's sacrum that does not blanch, turn white, when pressed. The aide should: Option A. Document it and turn the client. Option B. Massage the area to increase circulation. Option C. Apply heat to the area. Option D. Leave it alone. The correct answer is option A. Document it and turn the client. A non-blanchable reddened area is a stage 1 pressure ulcer requiring immediate documentation and repositioning. Massage is contraindicated. Heat is not indicated. Question 21. When assisting a client to walk, the nurse aide should walk: Option A. Behind the client. Option B. Next to and slightly behind the client, holding the gait belt. Option C. In front of the client. Option D. Far to the side of the client. The correct answer is option B. Next to and slightly behind the client, holding the gait belt. Walk next to and slightly behind the client on the weaker side, holding the gait belt to provide stability and catch them if they lose balance. Walking behind doesn't allow seeing the client's face. Walking in front is unsafe. Question 22. The nurse aide should document care: Option A. At the end of the shift. Option B. As soon as it is completed. Option C. Before providing care. Option D. Only if the client's condition changes. The correct answer is option B. As soon as it is completed. Documentation should occur as soon as possible to ensure accuracy and prevent forgetting details. Delaying to the end of the shift may lead to memory errors. Question 23. A client with a pulse of 112 beats per minute is experiencing: Option A. Normal heart rate. Option B. Bradycardia. Option C. Tachycardia. Option D. Arrhythmia. The correct answer is option C. Tachycardia. A heart rate above 100 beats per minute in an adult is tachycardia. This is above the normal range of 60 to 100. Bradycardia is a rate below 60. Arrhythmia refers to irregular rhythm, not rate. Tachycardia may indicate fever, pain, dehydration, or other conditions requiring reporting. Question 24. The chain of infection includes: Option A. Pathogen, host, transmission route. Option B. Air, water, food. Option C. Bacteria, viruses, fungi. Option D. Skin, blood, mucous membranes. The correct answer is option A. Pathogen, host, transmission route. The chain of infection consists of infectious agent, reservoir, portal of exit, mode of transmission, portal of entry, and susceptible host. Understanding the chain helps identify how to break transmission. Example, hand hygiene breaks the mode of transmission. Question 25. When dressing a client with a weak right arm, the nurse aide should: Option A, dress the right arm first. Option B, dress the left arm first. Option C, dress both arms simultaneously. Option D, dress the stronger arm first. The correct answer is option B. Dress the left arm first. Dress the stronger arm, left, first, then the weaker arm, right. This minimizes discomfort and strain on the weak arm. Dressing the weak arm first would require moving it more.